Hi, good afternoon again once more. I shall continue part B of this video from where I stopped. Again, I'm Ojan Bate. I stopped with anemia. Anemia is very important because sickle cell patients, our blood dies after 10 to 20 days. Meanwhile, the regular people, their blood cells die after 120 days. That's the reason why we have inflamed spleens, because the spleen is the one that filters these dead red blood cells. Meanwhile, the liver is the one that will detoxify all the breakdown red blood cells. So here's the problem. Our liver and our spleen, as sickle cell anemia patients and sufferers, works 5 times harder than a regular person our age that does not have sickle cell anemia. So here is what we're going to do. We're going to learn tips and techniques to help us go around this dilemma and still have a healthy life. To be realistic, yes, you will not be 100% as healthy as every other person there, but we can optimize sickle cell to a level where we're functional and live our daily lives comfortably and happily. So, anemia is the leading cause of sickle cell deaths according to statistics from CDC, which is Center of Disease Control. Sickle cell anemia lowers the red blood cells count. Sickle cell anemia lowers the red blood cells number. Sickle cell anemia lowers the amount of oxygen that you get to other parts of your body. We need oxygen everywhere, to our fingertips, to the toes, everywhere, pretty much. Our scalp of our head, you need oxygen. You cannot live successfully and completely without oxygen. That's why people die due to shortage of oxygen. Number one trigger of a crisis. Let's say you went to party last night, the place was very crowded. Patients, please, I'm not saying you shouldn't party. When you go out, take a water bottle. I go out, I take my water bottle. I watch my body. We're going to learn together how to listen to your body, what it's telling you, and when to say stop. Tell yourself stop before you get to a crisis. So it's a learning process. I wasn't always this good. I wasn't always this successful. I wasn't always the person that took good care of myself. I'll get into a crisis here and there that I can figure out, oh, that triggered it, but I could have stopped it. But I'm getting better, and I want all of us to get better together. So sickle cell is not always bad. How did it come about? Sickle cell came about as a way to help people survive malaria. In the old, malaria was very deadly, so those who had sickle cell trait would not get very severely sick from malaria. They could still get malaria according to research, but they will not be as sick as someone that doesn't have the trait. So that was kind of a resistance due to evolution. That's biology in the old. So that's how this happened. And as more people have the trait and survive, they passed on the trait to generations, and hence we as sickle cell anemia sufferers got the 2 genes, and the complications elevated and went up and got really, really serious, and to this point where we have to fight for our lives every day. So, signs and symptoms of sickle cell anemia. For every patient out there, you should know this already, but we'll go over it a little bit more. Individual signs and symptoms vary from one patient to another. You can have a crisis from your scalp to your gum or in your teeth. You can have a crisis, a severe headache that is just a crisis cause, all your joints, like swollen hand-foot syndrome, vaso-occlusive crisis, and you name it. There are so many. You can have acute chest syndrome, which is usually accompanied by pneumonia. One article said that the number one misdiagnosed issue of sickle cell in our African countries is that sickle cell is confused for pneumonia. That's because sickle cell patients are very much predisposed to anemia. That's why sometimes you can miss the diagnosis. But here we come again. I would emphasize this. No 2 sickle cell patients have the exact same symptoms, but at least 80 to 90% of these symptoms manifest in every single patient. Infections. You can have a low cold that a normal child with no sickle cell gene doesn't need medication to get rid of the cold. As a sickle cell patient, you don't take anything for granted, because that very cold might lead you to a crisis, and that very cold might land you at the hospital. So once anything is coming, you have to be alert oriented, act quick before it takes over you. Acute chest syndrome, when you feel like you can't breathe well and your chest pains so much, and it's usually really bad. But if you prevent a crisis from happening, you can subsequently prevent episodes of acute chest syndromes. If not prevent them, reduce the number. Strokes, you can have strokes. Let's say blood clot somewhere, because our blood, like I said before, is very fragile. It breaks and forms clumps. It blocks a vessel leading to your heart. You can have a stroke. I'm not saying all this to scare you people. I'm not saying all this to scare you. I have sickle cell. I'm predisposed to these symptoms as well. All I'm saying is that if we know the dangers, that is just a motivation to keep us fighting for our lives. We're warriors. We're sickle cell anemia warriors, and we have to take charge, take control of our lives by doing the simple and basic things like lifestyle modification, eating right, hydrating, drinking a lot of water, resting when we have to, take your naps seriously. I personally take my naps seriously. Maybe that's just from boarding school, but that's very helpful. You can have eye problems due to sickle cell, because you can have splenic crisis. Splenic crisis is the one that everybody out there is very familiar with. You just have this sharp, excruciating pain. You can't really explain. Sometimes it feels like someone is stabbing you. Sometimes it feels like someone is squeezing your veins. It's really hard to explain. And think about it. No one should tell you that, oh, you're 23 years old, Ojam Bate, you should be used to sickle cell pain by now. No. Sickle cell pain is chronic. You do not get used to it. That's why you want to prevent it before it gets too bad. Some of you are the patients, you are in pain every day. I'm quite not in pain every day, but I'm in pain sometimes at least twice a week. But I can shake it off because I've learned how to live around it and ignored it. Some days I can get away with ignoring it, but some days I know when I cannot handle it and when I need to take my medication for pain. So those are just the tips and things we're going to be learning together in this foundation. So I still want to welcome you and want you to feel at home. Treatments of sickle cell. Bone marrow transplant is the only approved treatment that is cure sickle cell, but there's thing with it. It's very risky. You can die. It's a 50-50 chance. You sign off your life. So I personally am 23. I will not risk it. I will not encourage a lot of people to do it, or anyone. Personally, from the things I've read and I know about it, studying immunology, I personally see that it's too risky. The risks outweigh the benefits. You can get heating pads, ways of soothing the pain, heating pads, pain medications. Oh, folic acid patients and myself, take your folic acid, please, every day. 1 milligram folic acid, the yellow pill, every day. Please take it. You think it doesn't do a lot. It does in the long run. Think about when you skip doses, that affects you. It accumulates. Please take it. I consider it like a meal, so I take it every day before I go to bed. Blood transfusions. If you're short of blood, you need a transfusion, get a transfusion. Don't hesitate. Like I said, I'm gonna tell you here and again, please, I want us to work together as a team and practice healthy eating, avoiding dehydration, exercising a little bit, getting enough sleep and rest, avoiding alcohol and smoke. You can drink alcohol a little bit, but if you drink a bottle, you probably want to drink 2 bottles of water just to dilute it in your system. I'm not going to control you out there, because I want you to live a complete life around sickle cell, but you need to be aware and very educated and tell people that, oh, you have sickle cell, drink water if you're drinking alcohol. Every little tip counts. There is part 3 of this video. It will be really short, and I'm sorry I can't be live. Thank you.